Hello, my name is Ravi Vij. I'm from My Cancer Haven, and in our conversation with Cancer Expert series today, we are fortunate to have Dr. Bita Fakhri from the Stanford University School of Medicine to talk to us today about frontline treatment for chronic lymphocytic leukemia. She's a rising star in the CLL world, and we are honored to have her today. Welcome, Bita.
Pleasure to be here, Dr. Vij.
So, Bita, can you give us an overview of what are the treatments that you have to choose from? You're getting more and more treatments into frontline CLL now.
Yeah, thank you for the opportunity. I always tell patients there is never a good time to get CLL, but there is no better time than 2024, just because we have a menu of treatment options available. As shown in this slide, they have the old chemotherapy options, alkylators such as cyclophosphamide, bendamustine, and we'll review the data, fludarabine. They have the CD20 monoclonal antibodies, which have been available in the field for the past 2+ decades, rituximab, and more recently, obinutuzumab, and the emerging data from obinutuzumab. We have the B-cell receptor pathway inhibitors, particularly BTK inhibitors, which have become very prevalent in the treatment of CLL. And now we know we have covalent BTK inhibitors, which bond a covalent bond with the CYS481 site of the Bruton tyrosine kinase enzyme. First one, which got approved for CLL 10+ years ago in February 2014, ibrutinib, followed by newer generation drugs, acalabrutinib and zanubrutinib. And more recently, on December 1st, 2023, we got the approval for non-covalent BTK inhibitor, pirtobrutinib, for patients with double refractory CLL. And double refractory are patients who have seen and failed a covalent BTK inhibitor in the past, and also a BCL2 inhibitor. The beauty of non-covalent BTK inhibitors, as you know, once you continue a covalent BTK inhibitor for a while, resistance mutations are inevitable. And the non-covalent BTK inhibitors, they're more liberal in their action. They bind, unbind, rebind, so they don't necessarily require that strict shape of the receptor to exert their function. Pirtobrutinib and nemtabrutinib is now currently in the clinical trials. PI3 kinase inhibitors belong to the